My name is Veronica, and I am a flight nurse for Life Flight of Maine. The shift starts at 7, and from there you never really know, and that's part of what I love about this job.
It's a very rewarding job to have in the state of Maine. You get to fly around a beautiful state, take care of some of the sickest patients in that state, and really make a difference in people's lives.
I'm Paul, flight paramedic with Life Flight of Maine. I've been here for a little over 2 years. We do 3 clinical shifts a week, 3 12-hour shifts, and then every other week we have either a staff meeting or a clinical case review, so that gives us extra hours, and then you have your obligation, either late calls or other education components. You're always striving to easily get 40 hours plus a week.
Life Flight offers an expanded scope of practice different from what a regular pre-hospital paramedic practices or a nurse at the bedside in an ER or an ICU. We can make decisions of which medications to deliver, how to treat a particular disease, because we have the education, training, and continued oversight that allows us to practice that.
I get to take care of patients everywhere from premature neonates through octogenarians. We have a comprehensive and progressive set of protocols. We have medical directors that are extremely supportive of the medical crew, and we have some of the best equipment available.
From Hamilton T1 ventilators to Sapphire pumps and Zoll monitors, we see everything from neonatal patients to geriatric patients, everything from cardiac specialty devices to include Impellas and balloon pumps and ECMO.
Almost all the meds that we carry or have access to, we are able to independently make decisions based on our protocol parameters of when and how to utilize them. For intubation, we carry the CMAC pocket laryngoscope. We have 3 different blades for that, and pretty much covers pediatric through adult. We have specialty isolettes at every base for our neonatal patients, so any patient less than 10 pounds. They provide a secure environment for the neonate that is also temperature controlled, and so that we can thermoregulate them. They have a monitor that is built directly into them, which again is a Zoll X series, and they have a built-in medical gas system so that we can do blended oxygen therapy as well as ventilator.
Life Flight of Maine is the only critical care transport agency in the state of Maine.
I love that we use multiple modes of transport here, so we're always motivated to deliver the best care and the care that a patient needs, no matter how we need to accomplish that.
Our mission is to provide critical care transport and access to that critical care medicine to anyone at any time at any place in the state of Maine. From the northern tip along the Canadian border to many of the islands off the coast.
My name's Jen. I work at Life Flight at the Lewiston and Sanford bases as a flight nurse. I have been an ICU nurse for about 6 or 7 years.
Requirements to get you in the door. We look for nurses and paramedics that have at least 3 years of experience at the bedside. Nurses in an ICU or a critical care area. Paramedics, we look for minimum of 3 years working in a busy 911 system with greater than 1,000 calls per year. Once someone gets hired into Life Flight of Maine, they get put on a very rigorous training program that includes a critical care academy. We utilize a phased approach to someone's orientation in that we validate skills in our simulation labs on high fidelity mannequins so that we can really ensure that the folks, when they complete orientation, have all of the training and skills needed in order to perform the job. The process takes approximately 5 to 6 months. It's very much based on what an individual brings with their experience and background.
And yeah, once you pass your final sim, you're off orientation, but still a lot to learn. Like, you learn so much, but you know that you're still just scratching the surface, really. And no one's gonna let you fail. Like, people actually wanna see you succeed.